This is Real Talk with Kike, and I'm still in the studio with the chairman committee on COVID-19, the Nigerian Medical Association Lagos State Chapter, Dr. Japhet Olugbogi. He has been on the show physically to discuss the magnitude of this proposed second wave and the complication we are likely to face pending the arrival of administration of the said vaccine. Thanks for staying with us, Dr. Japhet. It's absolutely a pleasure having you in the studio today, on set today, and of course, listening to you and again, emphasizing on the guidelines that we all need to stay true to. Please, I want to open my phone lines again. You can call us on 0700 923 923 923. Again, 0700 923 923 923 is the number to call. And of course, you can send us a message on 0817 313 6193. It's important for us to hear from you. Come and ask your questions with the guests we have in the studio today. And of course, if you have inquiries and comments and all of that, you can of course also send it via our WhatsApp line. Listening to you thus far, I know that the new strain that has surfaced in UK, like we were saying earlier, and that the government is willing to get the vaccine for its people. I know North Korea and Germany, according to reports, do also confirm that it has been a transmitted disease to the patient within the new cases of infection that is also in Nigeria presently. So my question now is, how do we actually get to that place if other countries, I know there are developed countries that are planning for their citizens, what are the plans of your own association or the government that they've planned for the citizens thus far till date?
Yeah, thank you very much. We don't know the real plans of the government yet, but the NMA would like to be involved in the distribution of the vaccine. Okay. The NMA should be involved in the distribution of the vaccine because it's a whole lot of planning, storage, distribution, even procurement to start with. So it's not something that should just be trivialized. When government does decide to actually procure the vaccine, they have to put together a task force, so to say, an amalgamation of people who would actually plan and develop a blueprint of how the vaccines should be distributed. We see what's happening in the UK. It is very, very, in fact, absolutely planned. They have this, I can't even begin to start talking about how they are even giving out their vaccines. They're starting with 80 plus, and then they are going to those who are 75 to 79, those who are elderly and have some diseases, and health workers and all that. So, these are the kind of priorities that we need to put in place when we start to, or when we actually finally lay our hands on the vaccine. It's a lot of money for Nigeria to procure. It's a lot of money for Africa to actually procure. But I know, I'm aware that, one or two NGOs are already offering to, help with maybe about 20 or 25% of the cost of all the vaccines. So Nigeria needs to dig deeper and find a way to find money. Yes, I like the way I put it. Find a way to find money to procure the vaccines because we have like a lackadaisical attitudes here in Nigeria concerning this COVID-19. There's no way number of cases would not go up with the way we behave. If you go to Balogun Market there right now, you would see a lot of people, are conversing, moving around, doing business without wearing the face mask. If you enter BRT, the same thing. And a lot of churches are still planning on having crossover services. We know how filled or how well attended these crossover services could be. We had a side rumor, a side talk of something that happened in Winners Chapel when a lot of pastors, a lot of people, had COVID-19 and then tried to, conceal that fact from a lot of people. So our behavior is not helping matters. And I think that's the kind of people who we are. If not, and now I'm sure at least 90% of our population is aware of what they should do right now, but they're just not doing it for one reason or the other. They're just not doing it. So if we cannot scale that through, then we need to resort to the vaccine. which it's expensive, which will take a lot of resources to actually store, move around, distribute, and actually get administered to the people. So all those things, the logistics around it, we need to factor out. We need to, work out even before the vaccines arrive. So that we need to avoid a situation whereby the vaccines come and then the politicians start jabbing themselves first or their loved ones first.
Yeah.
Before it actually gets to the people that need it, like those who work in the hospitals or isolation centers, the elderly people, those who are actually in the hospital, who are sick with one ailment or the other. These are the most vulnerable set of people that should get the vaccine first.
All right. Many thanks for that. Listening to you, I can help but ask this important question because I understand that, we've used Winners Chapel as an example right now regarding those that did not actually follow through the guidelines during the lockdown period. I think it's important for you to emphasize on this, that what are the punishments in place from the government if any of these churches decide to do crossover night, knowing that we are trying and the government and all of these things has to do with everybody coming together. What are the measures? What are the punishments if any of these churches decide to open the church for crossover night?
Yeah, if government says don't do this and any church or mosque or any religious house goes ahead to do that, I think the government should actually impose a heavy sanction on them. Okay. If we could close an event center because they hosted a party against government guidelines, if any church goes against government guidelines, that church or that religious
must go through that
kind of punishment as well.
Right. Many thanks for emphasizing on that. We keep hearing that the federal government has marked 54 billion for vaccine procurement, talking about, we need to look for money to get this and all of that, all of this politics. Yeah, right here on Real Talk, we keeping it real. How true is this and which of the vaccines are they going for? Because I know there's Pfizer from US, there's I don't know if I'm pronouncing it Sputnik or something like that from Russia, and a whole lot of them from UK as well. So can you advise us what kind of vaccines are the government going for?
I don't know the exact one that the government is going for.
Yeah.
Well, I can advise based on
540 billion.
Well, I don't know about money, but if we are being sincere with ourselves, government will actually need a lot of money. Yeah. But Nigerians are wary of government spending that amount of money on vaccine. Yes. If we are being sincere with ourselves, government will need as much as that, even more than that, to procure vaccines for Nigerians and actually see it through. That is jabbing people with the vaccines in Nigeria. Now, back to the type of vaccine. Well, I don't know. Mentioning a particular vaccine now would probably be advertising the vaccine, but I know there's some vaccines that could be stored below 70 degrees Celsius, below 50 degrees Celsius, below 38 degrees Celsius. Okay. I don't think those particular vaccines should be all right for us in Nigeria because, number one, they're expensive. Number two, they are also difficult to store. We don't have power in our country. We don't have stable power in our country. I don't see us being able to store vaccines at that degree at all. Without losing the value, the potency of that vaccine. So we should go for the ones that are easily stored, that do not need to be stored at such lower temperature. There's a new vaccine now that the government of UK is planning on getting maybe by next week. Okay. I think that one is cheaper and it's also less cold when it comes to storage and all that. So the government can go for that. Because with little money, we'll be able to buy for as many people in Nigeria as possible. Then we'll also be able to maintain the cold chain without losing the potency of the vaccine. All
right. Many thanks again for that submission and of course for the transparency on that. The crisis we faced in the first wave was lighter compared to the second one, if there's going to be anyone. Now we have recession, we've had NSARS issues and so many other things, insecurities and all of that. Do you think that this is a more critical period to manage the crisis of COVID-19 second wave?
Yeah, I think it's a more critical period because we can't even afford to go on a lockdown. What we can do is to ensure that maybe those who are not wearing the face masks or any event center or churches who is not obeying the preventive measures should be sanctioned. If we put a heavy sanction on ourselves, maybe disturb those who are not wearing the face mask, people will actually resort to wearing the face mask. But having a lockdown would be really bad for our economy right now.
All right, many thanks. Again, this will be my last question to you because of time. I believe we've run out of time. But of course, I'm going to bring you on my Instagram live session because, we need to really reorientate the people and let them also continue to, face. I'm sorry to say this. I know this is not what people want to hear, but I believe that COVID-19 is here to stay, just like HIV and all of that. We have to learn how to live with it, So, but my last question to you is, I know that palliatives are always consequential to ease lockdown pressure and humanitarian needs, so to speak. I'm very big on that. It's important for us to try to help people who are in need. So, are we likely to face a lockdown in January? What sort of palliative measures are in place for the people?
Yeah, I wouldn't know exactly what the government is planning on that. And even if I do know, I shouldn't be, speaking for the government if government does not send me to speak on their behalf. But then again, if we do have a lockdown, I'm sure the government would put in place some form of palliative. If they don't, I'm sure the Nigerian Medical Association will be on their, we'll be knocking them to provide palliative for people. In fact, we'll be advising them against a lockdown. But if that comes to if you come to the last decision and they have to lock down, of course they have to provide palliative for the needy as well. All
right. Thank you. Dr. Japhet, you have entirely demonstrated the strength of your expertise in the health field. I must emphasize on that. And your vastness in our health sectors. Again, I say kudos to all your efforts in the fight against COVID-19 period. And we say a big thank you as you respect the call of saving lives and at all times. And of course, continually orientating the people and the nation to follow the guidance of WHO. Thank you so much for spending part of your evening with me in the studio. And of course, let me say this, Happy New Year in advance. Let me be the first person to wish you Happy New Year in advance.
Thank you very much for having me.
Yes.
Yeah, I must commend you and other media outfits as well for the good work you're doing. A lot of people are not giving the media the accolades it deserves, but we give the media the accolades it deserves. So you're doing a wonderful job.
Thank you so much, Dr. Japhet. Again, this is where I draw the curtain of the show today. But of course, before I go, our closing remark, courtesy of Moluabi personality from Govt. My main sponsor is what? When there is life, there is hope. And when there is life, we can marry. I know that merriment is in the air right now. We should remember that social distancing and washing, avoidance of public places, wearing a face mask, and other health tips are key to staying alive in this season. We should make that resolution to stay safe now and beyond into the new year. And I wish everybody a wonderful new year in the community in 2021. So this is where I draw the curtains of the show for the year. So I come your way next week, next year, 2021. I'm so excited. Remain blessed and at peace. My name remains Kikela Matondao, and you have been on Real Talk with Dr. Japhet and I.